recommend not taking antioxidants during the acute phases of radiation therapy or chemotherapy, because cancer cells, or a lot of the death of cancer cells by these therapeutic agents, is related to free radicals. So if we're going to make free radicals, we want them to act on the cancer cells.
Does glutathione have any effect on thyroid disorders? Is it contraindicated in thyroid malfunctions?
When I came here on Tuesday, I wasn't aware of any effects of glutathione on thyroid disease, but since then I've had this question asked to me, and my colleagues have already helped me by looking up the answer to this. Thyrotoxicosis on one side and myxedema on the other side, both are afflicted by oxidative stress. I don't know whether these are reports in the Turkish Journal of Endocrinology. I don't know glutathione levels in thyroid disease, so I can't make any comments on it. I will say that one of the dermatologists who questioned me on Wednesday on this had asked me whether, had actually told me her personal experience that when she ingested glutathione, but I was subsequently notified that that was an older preparation on the market that had some thyroid stimulating activity. So I have to tell you that my limited knowledge of thyroid and glutathione is that it is associated with these two conditions. What other effect glutathione may have on thyroid hormone, today I don't know, but I'll assure you that I'll know next time I come to the Philippines.
Okay, so more extensive studies.
Yes, yes.
Another question is, how true is it that glutathione hastens the graying of one's hair?
That it does what to hair?
It hastens the graying of the hair.
I was hoping you said that I was hoping you said it grows hair, because I'd love to see that. But I take about a gram, 500 milligrams twice a day of glutathione. I can tell you it hasn't affected my hair growth. I guess theoretically...
Pardon, sir, it's not growing, but...
No, I know what you're asking me, graying of the hair. We have not seen any, we haven't had anybody tell us about it or complain about it. Certainly there is a depigmentation of the skin, so I'd be interested to know somebody else's experience. I have not seen it. I guess theoretically I would think it's possible. I'm going to look into that for you.
Pardon, sir? How often?
How often what?
How many here saw a change in the graying of one's hair of the patients? Wala naman. Okay, the last question is, I have a patient who is menopausal. Okay.
Dr. Hurst,
yes.
There are preparations of glutathione with rose hips, alpha-lipoic, and vitamin C. Are they better than the plain glutathione?
Couple of comments on that. Obviously, vitamin C has an effect on the DOPA mechanism in the melanin cycle, in addition to the values that we've already mentioned for glutathione in inhibiting tyrosinase activity and in promoting pheomelanin synthesis compared to eumelanin synthesis. Rose hips is primarily a vitamin C preparation, as I know. I think that and then you have your vitamin C, so that you're attacking your composition, as most of the ones that I'm aware of in the market all have some vitamin C. In part is not just for the depigmenting effect, but in part, and I'll get to lipoic in a minute, in part is for the depigmenting effect, but in part is also because you're providing a good nutritional supplement by giving your antioxidants here, and you saw how well they work together in the cell. So it's better health to give them together because of how they're working together. Now, lipoic acid is another story. Lipoic acid, you'll be astonished, lipoic acid is not an antioxidant. Lipoic acid is a sulfur-to-sulfur bond. In the body, that sulfur to sulfur, much like the GSSG I showed you, that SS bond has to be broken, and you put hydrogen ions on it, and it becomes dihydrolipoic acid. Dihydrolipoic acid is the antioxidant. It's very short-lived. And one of the beauties of dihydrolipoic acid with this SH, two SHs, is that it gives it to the GSG and provides more glutathione around. So it's a mechanism to increase glutathione.
Okay, thank you.
In your own opinion, sir, what is the best combination with glutathione?
Well, I think what I told you. I think that the best combination, you're talking about general nutritional supplement, is glutathione with selenium, with vitamin C, and with vitamin E. If you have reasons to increase your carotenoids because you're dealing with a patient with an eye problem, macular degeneration, you obviously want to increase your vitamin A or your carotenoids. If you're dealing with mitochondrial dysfunction, you want to include the coenzyme Q10. You got to look at your patient and you got to see what you're on. You can't just toss the medicines there, toss the antioxidants out there. What am I treating? Do I have a diabetic patient with injury to low-density lipoproteins? I certainly want to include my vitamin E, probably a little higher dose, not extreme levels as we were given 5 years ago, but make sure that the vitamin E is there. Make sure that you have your C and glutathione and selenium to regenerate your vitamin E. So it's not a matter of giving one alone, but it's giving the right family of antioxidants to treat cosmetically or to treat therapeutically.
Okay, so that's the best combination.
Correct. Which is, best combination. That's what the body uses. You want to add grapeseed extract, that's wonderful. You want to add green tea, those are wonderful antioxidants, but they don't stay in the body. So you've got to see if you got a smoker, you want to enhance your antioxidant supplies as much as you can. I didn't show you a slide that I have of vitamin C levels in smokers. They have lower levels of vitamin C, but most of that vitamin C is oxidized. We got to get rid of the oxidized vitamin C. So the best preparations are those that you look at your patient and you see, much like you treated their acne or their psoriasis, what is that this patient need, to certainly include the combination that exists in every cell and that works primarily. All the others are adjuncts and they are of absolute value. We're not knocking any one of them, but you got to know what you're prescribing.
Okay, sir. We have another question here. Do you have studies on the effect of GSH on vitiligo?
And no, I don't. Somebody asked me that question in another dermatology group. I don't have any information on that.
Okay. The last question.
But again, I certainly will next time I'm here.
Yeah, we'll wait for that. Do you still recommend glutathione for diabetic patients with end-stage renal disease or diabetic patients with below 40% function of the kidney?
Well, you've got to treat the primary disease. There's no question that oxidative stress has been documented in patients with chronic renal failure. No question that oxidative stress and low levels of glutathione have also been described in patients with essential hypertension. Being in oxidative stress, you've got to protect the rest of the system. You've got to boost their immune system. You've got to increase their antioxidant stores. So yes, there's a room for these, for the glutathione complex, if you want to use my words, in these chronic debilitating patients. You'll make them stronger. The only exceptions I told you about were cancer chemotherapy and cancer radiotherapy patients. But there's no question that we put our patients with chronic renal failure. Is it going to help the renal failure? We know it does help the hypertension. I don't know if it'll help the chronic renal failure, but there's no question, studies have been done to show that the oxidative stress in chronic renal failure is decreased by the administration of these antioxidants.
Okay. So we have no further questions. May I call on Dr. Perez and Dr. Pineda?
The Philippine Academy of Clinical and Cosmetic Dermatology presents this plaque of appreciation to Dr. Theodore Hirsch, MD, for his lecture on cosmetics as therapeutics and vice versa, the role of glutathione antioxidants, during the 3rd PACCD Annual Convention, given this 30th day of September 2006 at Crown Plaza Hotel, Ortigas Center, Pasig City, Philippines. Signed, Vincent B. Pineda, MD, President, PACCD, Rosario Perez, MD, Convention Chair.
Okay, thank you very much again, Dr. Hirsch and Mrs. Hirsch. That was a very comprehensive lecture.